Hi, my name's Allison and I'm in my last semester at Delaware Technical Community College. Today, I'll be talking about the things I've learned so far in this ethics class and how these things will help me in my future career as a histotechnician. Ethics is very complex and has many different aspects to it. Essentially, it is a branch of philosophy that looks at morality. Ethics helps us to make decisions on what is right and wrong and good and bad. There are many different ways of thinking about and understanding ethics. Many people use the Socrative method when it comes to thinking about ethics. To put it simply, the Socrative method is almost like acting like a child. What I mean by that is the core principle of this method is to never stop asking the question why. So when people have a theory that they want to test or a belief that you want to test, you pretty much just keep asking them questions, keep asking them why it's true until you can't ask any more questions. And what this does is it helps them define their statement better and helps them make a more sound statement overall. There are also many different ways people think. There's cultural relativism, which it says that things are morally right or wrong based on the person's culture. There's subjective relativism, which is the belief that something is right if someone believes it. There's objectivism, which states that some moral norms or principles are universal. And there's also emotism, which is the view that moral utterances are neither false nor true, but are expressions of emotions or attitudes. Another thing I've learned is how to evaluate a moral argument to see if it is sound or not. You do this by looking for certain aspects. Every argument will have a conclusion and a premise. The premise are statements that are also facts that support and prove the conclusion. To spot these statements, you can look for indicator words. Indicator words for the premise are since, for that reason, and indicated by. When spotting the conclusion, the indicator words are as follows. They're consequently, it must be that, and as a result. Another good tip when picking apart an argument is to look for the conclusion first. It's way easier to look for the premise statements when you know what they're going to be proving. There are also two different types of arguments. There's deductive and inductive. Deductive arguments give logical conclusive support to their conclusion. Inductive arguments use probable and not decisive support. Each of these also have further ways of determining them. Deductive arguments can be valid which means that their premises are true, or invalid, meaning their premises are not true. Inductive arguments can be strong, which means that the premise is true, then the conclusion is probably true, or weak, which means that the premises are true, the conclusion is not probable at all. One thing you need to do when evaluating an argument is test the premise. You can do this by trying to find examples that counter it. If you can't find an example that counters the premise, then it's a sound premise and it's true. There are also patterns in bad arguments, and there's examples of different kinds of bad arguments that people can give you. And they are begging the question, equivocation, appeal to authority, slippery slope, faulty analogy, appeal to ignorance, straw man, appeal to the person, and hasty generalization. Each of these can be tricky to see when presented to you. Also with ethics, there's different theories people believe. There's a lot of them, and I'm going to list each one and give a brief explanation. So there's the consequentialist theory that states that what makes an action right is the consequence. There's the non-consequentialist theory, which is pretty much the opposite, well, not the opposite, but it states that the rightness of an action does not depend on its consequence. There's utilitarianism, which a lot of healthcare facilities go by, and they also go by the next one, which is act-utilitarianism. And they pretty much assert that the right action is the one that produces the most good. And then there is rule utilitarianism that says the best action is the one that follows the rules. There's ethical egoism, which says the best action is the one that gives the person themselves the best good or the greatest good. There's Kant's theory, which states that the right action is the one that follows the categorical imperative. There's the natural law theory, which says the right option is the one that follows human nature. And finally, there's divine command, which states the right action is the one that God commands. As I said earlier, the degree that I'm getting is a histotechnician degree. With this degree, I'll be testing tissue for disease and for certain kinds of cancer. Ethics will come in handy when I will get into situations where I know the patient's name or I know someone who knows the patient. I had to make sure that I am ethical and moral, and I don't tell the patient or I don't tell someone I know that they're in the hospital or that they're getting tests done. Ethics will also come in handy when I have to, deal with patients who might not be necessarily happy with me or happy with the results. I have to make sure that I treat them with respect and I don't lash at them as if they're, or like they're lashing out towards me. I also think it is helpful for anyone in healthcare to learn the different ways that people think, and I'm doing that by learning the different theories for moral codes. And the reason why I think that's important is because if you understand how someone thinks, it can help you better understand where they're coming from and maybe not feel negative towards them or feel like they're lashing out against you. You'll understand where they're coming from. So overall, this class is very beneficial for me, and I can't wait to see what I will learn next. Thank you for listening.